Great. Thank you so much, Angie. I truly appreciate it. And thank you to everyone for being here today. So let's begin our presentation. Today, we are going to be discussing the gut microbiome and chronic disease. So we're going to take this back all the way to the beginning of medicine, in which Hippocrates stated that all diseases begin in the gut. Well, we do know today that that is not exactly true, but it is somewhat true. And so today we will be discussing some diseases that do begin in the gut. Let's begin. And as Angie has stated, I am a staff doctor of the clinical education department at Doctors Data. So disclosure there. All right. So with regards to chronic disease, that's going to be the topic of conversation today. We're going to start with a question. What percentage of national health care is spent on chronic disease and mental health? Actually, chronic disease does include mental health. So what do we think if we could put these answers in the chat? The options are 20%, 50%, 75%, and 90%. So with regards to chronic disease, previously in the 60s, it was actually 4% of the population had chronic disease and ages, 0 through 18. Today, for this generation of children, actually almost half, 46% of children will have a chronic disease during their lifetime. So what percentage of healthcare? I see some guesses, 50, 75, 90. Okay, let's reveal the answer here. The answer is 90%. So 90% of healthcare spending is spent on chronic disease, including mental health. That's a huge number. And in the United States, we do kind of a silly thing in that we are really waiting until the development of a chronic disease, and then we are going to address it. So as you can imagine, that can be quite costly and actually ineffective. So what we're going to be discussing today is considering the foundational component of chronic disease. And as Hippocrates said, all disease begin in the gut. We know that some diseases do begin in the gut, and that really is those metabolic chronic conditions. So that's what we'll be discussing today, and really utilizing a foundational approach to prevent these diseases and consider the pathogenesis. What chronic diseases will we be discussing today? We will be discussing cardiovascular disease, as this is still the #1 cause of death worldwide. We will be discussing cancer. Cancer has really evolved with regards to treatments, but this is still increasing in incidence. We'll be discussing diabetes mellitus type 2, formerly called adult onset diabetes. Unfortunately, so many children developed type 2 diabetes that is now called type 2 and not adult onset. We'll be discussing obesity as a prevalent chronic disease. Not only is obesity prevalent in the United States, in North America, we are seeing increasing incidence across the globe. India now has increasing incidence of obesity, so much so that there is popularity of children's gastric bypass surgery to address this condition. And we're seeing that in the blue zones, in where people have historically consumed nutritious food such as beans and rice and corn, now the younger generations are moving away from those food items to the processed food that the standard American diet is known for. We are really seeing that as we export the standard American diet across the globe, increasing incidence of obesity. Arthritis is also a chronic disease that does have a root within the gut microbiome. Alzheimer's disease is a terrible, debilitating disease that is on the rise, and we are learning more about the pathogenesis as this of this disease, you may have seen recently in the news, that the plaque hypothesis may be negated. And that may be actually due to cellular inflammation. And we're going to discuss how thinking about the microbiome in regards to this disease can help our patients and improve their outcomes. Depression is a chronic disease. And I was surprised to learn that in doing my research, because I don't know about you, but sometimes I think about depression, anxiety, those conditions in one category, separate from cardiovascular disease, diabetes, arthritis. But really, these are all chronic diseases, and we can consider the gut microbiome here. We do know that depression does have a strong link with regards to the gut microbiome. So let's take a look here at the gut microbiome. As we will be discussing the gut microbiome today, let's take a foundational look at the gut microbiome. The gut microbiome consists of bacteria and their metabolites, viruses, archaea, and then sometimes parasites as well, and yeast. With regards to the gut microbiome, the basic constituents are the bacteria, and the bacteria are derived from a variety of factors, including our birth. So whether there's a vaginal birth or there's a C-section birth, that can change the gut microbiome. Diet as well, whether an individual was breastfed or bottle fed. These things do make a difference. At the end of the day, diet is a large factor which we can make influences and changes to change the microbiome and hopefully systemic outcomes. With regards to that, really the pathophysiology is the food that we eat when it is digested into fats, carbohydrates, proteins, and fibers. Those become substrates to feed the bacteria in the colon. When the bacteria consume those products, they ferment products like short-chain fatty acids, butyrate, acetate. And these microbial metabolites mediate systemic physiology. Generally speaking, these microbial metabolites send a signal of reactions via vagus nerve to systemic physiology. And so that's where really you get this foundational component of the gut microbiome and systemic outcomes, such as bacteria in the colon influence short-chain fatty acids, which can influence blood pressure, or bacteria in the colon influence neurotransmitters, such as serotonin, which can go on to influence mental health status. So that is the physiology there. And then when we're looking at the gut microbiome, we are going to talk about the foundational components, diversity and abundance of the bacteria. With regards to microbiome abundance, this simply means how much bacteria is within the human colon. An appropriate amount of bacteria within the human colon, it generally is a larger amount of bacteria, because what we're seeing as a trend globally is the decimation of the microbiome and decreasing bacterial abundance. Same for diversity. So we want an appropriate amount of diversity. We actually don't want diversity is a little bit complex, and that generally higher amount of diversity is considered healthy. So with this, I like to think of an ecosystem. So the gut microbiome is akin to any environmental system. If you went out into a forest, you would expect to see a forest that has a rich abundance and diversity of flora and fauna. So different types of flowers and grasses and animals. And once you start seeing less diversity in the ecosystem, it becomes unhealthy. We know that with example, the rainforest and things of that nature. The gut microbiome is similar. So we want to see a rich, diverse microbiome. There is a caveat there, which I was alluding to previously, in that there can actually be, in some rare instances, there can be a diversity pattern that is associated with the pathogenesis of disease, such as IBD and things of that nature. That's a unique situation, but generally speaking, diversity is healthy within the human colon. So we do want a diverse, abundant bacteria within the human colon. That is associated with positive health outcomes. The other concept with regards to the gut microbiome is that balance is very important. We can see in the graphic here, we're talking about the phyla, the main phyla of the gut microbiome. And that's going to be the Firmicutes, the Bacteroidetes, the Actinobacteria, the Verruca microba, and the Proteobacteria. And really, it is important to have balance. So once one of these phyla increases or decreases, it really is going to signal another bacterial phyla to compensate. And therefore, balance is a foundational component of the gut microbiome. Within medicine, sometimes we think of a monotherapeutic approach. As an example, if somebody has elevated cortisol, we are thinking about using a statin to disrupt that HMG-CoA reductase physiology. With the microbiome, a monotherapeutic approach might not be the best approach simply because these bacteria communicate with one another. And then the balance and levels of one phyla or one bacteria is actually related to the balance of the other bacteria in the entire ecosystem. So it brings us back again to understanding the concept of diversity and abundance of the bacteria as a whole. Now, that being said, we can elucidate specific keystone bacteria. In this regard, everyone is familiar now with lactobacillus. Lactobacillus is a household name. We have other bacteria in this regard as well, such as Faecalibacterium protenitzii, which is a key butyrate producer, anti-inflammatory bacteria. And then a new kid on the block, Akkermansia muciniphila, is very important, and we will talk about that today. So really, with regards to the gut microbiome, we want to take a balanced approach and understand the different constituents. The first disease we will talk about today is cardiovascular disease. Now, cardiovascular disease is still a leading cause of death worldwide. This is a lifestyle disease with a nutritional component. So we can really see here that the gut microbiome has a place. The microbiome dysbiosis has been associated with the progression and pathogenesis of cardiovascular disease, and this has been implicated in heart failure, hypertension, atherosclerosis, and also cholesterol metabolism. An alteration in diversity and composition of the gut microbiome has been implicated. Here we're seeing some evidence for the dysbiosis as well as short-chain fatty acids, especially acetate. So the exact mechanisms are unknown, but it has been shown that the short-chain fatty acid acetate and fiber may actually decrease cardiovascular pathogenesis, and there may be a vasodilatory, anti-inflammatory component there. Now, one of the things that we will talk about today is TMAO, trimethylamine N-oxide. And this goes, let's take a look at the next slide here. So how many people have heard the concept that we should not eat red meat? Red meat is unhealthy for heart health. And did you know that has a role in the gut microbiome? Because what happens is when people consume red meat, a large part of that is going to be choline, betaine, and L-carnitine. When the choline, betaine, and L-carnitine interacts with the gut bacteria, a product of that is going to be trimethylamine N-oxide. And that trimethylamine N-oxide will go on to travel to periphery, including the arteries and the brain, and that is going to be associated with the adverse effects of red meat. So that's going to be associated with stroke and myocardial infarction. So that's where that is. So really there is this strong connection between the food we eat, the bacteria in our colon, and then these physiologic outcomes. So most people don't understand that advice to decrease red meat consumption has a gut microbiome component. In this regard, we could consider modifying the gut microbiome or understanding the composition, the diversity, and abundance of the gut microbiome in these cases. Our next point we will be discussing today will be the gut microbiome and cancer. So over 1.6 million Americans are diagnosed with cancer. It is very important, according to the American Cancer Fund, that disease prevention strategies and screening are performed. This is a role for the microbiome as well, because we're talking about a foundational component. I want to be clear here. With cancer and the gut microbiome, we are not talking about treatment strategies. The important consideration here is the link between the gut microbiome, the immune system, and cancer pathogenesis, but also cancer treatment. We know that there is a link between the gut microbiome and the immune system. And some studies are showing that modulating the gut microbiome during cancer immunotherapies can improve treatment outcomes. So that's really where this is. And in the future, we might see therapeutics that are specifically targeted at the microbiome to potentiate the effects of chemotherapy or things of that nature. So with regards to cancer in the gut microbiome, there will be more to come, but the considerations are a foundational approach and the prevention. Diabetes is the next talking point about the chronic conditions and the gut microbiome. So according to the CDC, over 30 million Americans have diabetes, although importantly, more than double that, so over 70 million Americans can have pre-diabetes. So that's a very important point to intervene at that level when somebody has pre-diabetes. Now, generally speaking, with regards to this, we're thinking about glucose tolerance, we're thinking about insulin resistance, we're thinking about metabolic syndrome, but we can consider the gut microbiome as well. We do know that nutrition and metabolism play a role in the pathogenesis of diabetes, and we do know that the microbiome plays a role as well. Interestingly enough, of note, type 1 diabetes, which we don't necessarily associate with nutrition, there was an increase after World War II in the Western world, and this was actually potentially denoted to the food changes in which prior to World War II, people were really using farms and things of that nature. And then post-World War II, we're seeing the industrialization of the food industry. So that's an interesting finding there. Diabetes is strongly linked to metabolic syndrome, and same thing with the gut microbiome. This does influence metabolism. One of the key bacteria here is going to be Akkermansia muciniphila. Studies have shown that Akkermansia muciniphila improves insulin sensitivity and also glucose tolerance. So this will be a key bacteria to identify in patients that have diagnoses of diabetes, but also diagnoses of prediabetes or family history of diabetes. I would take a look at that Akkermansia muciniphila level. Other studies have shown that individuals diagnosed with diabetes display dysbiosis. And in those cases, there is increases in Clostridium hathaway, Clostridium symbiosum, and Escherichia coli. So you might want to pay attention to these bacteria as well. Our next condition will be obesity. It's fairly reasonable to consider that obesity does play a role with regards to the gut microbiome. Now, this could be a whole talk itself, because we know that obesity is a prevalent condition, and we know that it was prevalent before the pandemic, but there is some evidence that during the pandemic, people did gain weight, which is understandable, unfortunately, but it did happen. And there is some evidence that after the pandemic, people tend to actually not lose that weight, and it becomes their weight moving forward. So there is a consideration that obesity has increased, and then we have a post-pandemic increase as well, which we should pay attention to. With regards to this, unfortunately, there is the incidence is 1/3 of adults, but it's 1/5 of children, and that is just increasing. And obese children will become obese adults. So we really want to intervene, and we want to think about the gut microbiome as a foundational component here. According to Harvard T.H. Chan School of Public Health, prevention strategies include physical activity, diet, screen time, sleep, and stress management. So we do know these things, but I will tell you that diet sleep pattern, stress, physical activity, those are all do have roots in the gut microbiome. Screen time may or may not have a root in the gut microbiome, but I could think a little bit about a dopaminergic pathway, and I actually could think about how the fact that gut diversity does influence behavior. So there's a connection there as well, potentially. With regards to obesity and the gut microbiome, we do want to think about inflammation. So diet-induced inflammatory changes can precede pathophysiology of obesity and metabolic syndrome. Diets, gut microbiota, and absorption of influences all go together. We know that individuals are consuming more and more a caloric dense, nutrient deficient diet. And the fact that the food that we're consuming is continually devoid of nutrients, that does play a role in physiology. And then if you add on top of that, if patients have nutrient absorption issues, so if they have low HCl, low elastase, which we do see, then there's even less absorption of nutrients. So individuals are, generally speaking, potentially prone to nutrient deficiencies. So we're talking about amino acids, and we're talking about minerals, magnesium, we're talking about vitamin D, all of these really important core nutrients. That's a consideration. Now, with regards to the studies, we had previously been taught that a decrease in bacteroidetes with an increase in firmicutes is associated with obesity. Now, studies continue to evolve, and what we are learning is that may be far from consistent. So that's not something to hang our hat on, but we will see some bacteria that do provide some good information on this topic. One of the considerations right now that I've recently heard of that's pretty interesting is fecal microbial transplants early in life to be stored for later in life. So you may not have heard of this yet, but a talking point with regards to chronic diseases, diseases of aging, obesity, things of that nature, is that we may come to a point in which people could, in their young 20s, when they're healthy and lean, they can collect their microbiome, and then they could store that later in life to address these potential pathogenesis of these chronic diseases. So that'll be an interesting thing to see if that happens. So with regards to obesity, what are the changes that we do see at the species level in the microbiome? Well, we do see some levels change with specific bacteria. We see disruptions in the level of the Clostridium inocuum, Eubacterium dolichum, the Cantibacterium moutsaki, and 2 lactobacillus species, as well as the actinobacteria. Again, here's a point where microbiome abundance and diversity are key. Low diversity and lower abundance can be associated with metabolic syndrome. And then we want to consider that the microbiome can change our food preferences, yeast as well, right? That can change food preferences. So it's important to understand and look for those. One point here, the popularity of the GLP-1 agonists such as semaglutide and Mounjaro actually does play a role in the gut microbiome. Now, the gut peptide GLP-1 is actually made in the colon. And what we can see here is the bacteria Akkermansia muciniphila and the bifidobacterium do trigger the production of GLP-1. And that is especially in the presence of polyphenols and short-chain fatty acids and GABA. Now, of note, the endogenous GLP-1 has a very short half-life. I believe it's 2 to 3 hours, whereas the pharmaceutical GLP-1 have a half-life of 7 days. So there is a difference there. But we do know that individuals on the GLP-1 agonists tend to have GI side effects, and utilizing a gut microbiome approach is going to be a way to eliminate those adverse side effects. Of note, Akkermansia muciniphila has been shown to increase thermogenesis and the brown adipose tissue. So increasing thermogenesis and brown adipose tissue will lead to weight loss. And then bifidobacterium itself does play a role analogous to the GLP-1 receptor agonist. So taking a look at the levels of bifidobacterium and Akkermansia muciniphila could prove fruitful. Arthritis is going to be the next condition that we're going to look at. So there is a connection between the gut microbiome and arthritis, especially bifidobacterium and bacteroides. So they may be decreased while the species Prevotella may be increased. One of the things we can understand about the gut microbiome is by looking at germ-free models of animals. So in animals, it was noted that when there were germ-free animals, they did not develop arthritis. So that lets us know that there is a link between arthritis and the gut microbiome. Another consideration here is going to be diet and inflammation. And then we also want to consider the autoimmune process here. So dysbiosis is associated with intestinal permeability, which is associated with autoimmunity. So there's a connection there. Another clue that we have is that certain prescriptions used to treat rheumatoid arthritis have antimicrobial effects. And it was noted that in patients taking RA drugs, their microbiome improved as well. So we know there's a connection there. Another consideration unique to the microbiome is that fecal secretory IgA, when it's elevated, may be found with reactive arthritis as well. And Alzheimer's disease, we will talk about as well. So Alzheimer's disease is amongst the most common causes of death in the United States. Currently, there's no established way to prevent Alzheimer's disease. This is linked to depression and nutrient deficiencies, which have a role in the gut microbiome. The nutrient deficiencies are going to be these antioxidants. And so again, here's a consideration for digestion and absorption of the in the colon. We do know there's a connection between the gut brain, so that gut brain axis, the human microbiome does act as a second brain. There is a connection there. And then we do know that when there's disrupted abundance and diversity, there is disrupted neurotransmitters and neuromodulators that do play a role in Alzheimer's, such as serotonin, kynurenine, and catecholamines, as well as the amyloids. So it has been postulated that Alzheimer's disease may begin in the gut and is related to gut microbiota imbalances. Of note, the newer research is negating that beta amyloid plaque pathogenesis hypothesis, and there is a consideration that actually the cells themselves are inflamed prior to the plaque formation, and potentially a consideration would be the detoxification and elimination of those inflamed cells. And that would be via the lymphatic system. So the lymphatic system is how our brain essentially cleans itself while we're sleeping at night. So there is a connection with the gut microbiome and sleep as well. So a consideration there. We always want to reiterate that sleep is such an important part of health. Okay. And then the last condition here is going to be depression. So depression is extremely prevalent, and pre-pandemic, according to the NIH, there's about 17 million adults in the United States that had at least one major depressive episode. So, chances are if you are not treating your patient for a mental health condition, they might have one as well. So if you're treating your patient for cardiovascular disease, there may be a mental health consideration as well. So we want to learn about this as well. There is a strong connection between the gut microbiome and mental health. And that's really because there's this gut-brain axis. As we said, the majority of serotonin is made in the gut. Now, that colonic serotonin does not directly translate to neuronal serotonin. The consideration is that when serotonin is synthesized in the gut, it triggers chemical mediators to travel via the vagus nerve, which then stimulate neuronal serotonin. So it is directly connected. So there's a strong connection between the gut microbiome and well-being. Additionally, there is a strong connection between IBS and IBD and depression. So in patients that have these conditions of IBS and IBD, you want to actually think about mental health as well. Of course, those conditions are very difficult to live with, so that itself could be causing the mental health, but there also can be a link between the dysbiosis present in those GI conditions and the mental health status of depression. With regards to the gut microbiome of depressed individuals, we can see some significant changes. Bacillobacterium species is shown to be increased. Fecal bacterium proteiniceae is shown to be decreased. Of note, fecal bacterium proteiniceae is very anti-inflammatory. So there's an inflammatory component here. The actinomyces are inversely associated with depression in IBS patients, and then allostipes is positively correlated with depression. All right. So when we're talking about gut microbiome health, what are the components? Again, diet is very important, as we have seen. Specific nutrients are very important. We can see that especially fiber is a component of the microbiome, but we can see how those specific nutrients, we talked about the antioxidants and how those can be related to Alzheimer's disease. So when we're talking about the gut microbiome, we're talking about specific nutrients and then potentially physiologic outcomes. With regards to evaluating the gut microbiome, it is important to assess the patient's microbiome and address what they have individually for them. Consider the components of abundance and diversity. Remember, balance is key. We are going to take a look at intestinal permeability because intestinal permeability is associated with a variety of physiologic outcomes, including depression, and there may be a role there for some cardiovascular considerations. And then, of course, with regards to the gut microbiome, we want to look for the bacteria themselves, the presence of parasites, the presence of yeast. And we also want to think about the parasympathetic nervous system. So with vagus nerve, with colonic motility, those things do play a role. And eating hygiene is an important aspect of gut microbiome health. So that is going to be, does your patient sit down, chew their food, enjoy meals with others? We know so well that the Mediterranean diet is beneficial for our health, especially with regards to cardiovascular outcomes. But did you know that the bottom of the Mediterranean pyramid is actually sitting down and enjoying meals with others? In the United States, we just have bread on the bottom. So we do want to think about diet, but we also want to consider eating hygiene in that context as well. We're going to take a minute to discuss intestinal permeability because intestinal permeability is associated with some chronic conditions. It's associated with type 1 diabetes. There's an association there with celiac disease, rheumatoid arthritis, IBD. There is an association with depression as well. The pathogenesis of intestinal permeability can be such that when an individual develops gut microbiome dysbiosis, the correct bacterial balance and abundance is not there. Then what can happen is, especially if you have decreases in specific bacteria that are associated with that mucosal barrier integrity, that mucosal barrier integrity can become compromised. Then the third consideration is once that intestinal mucosal barrier has become compromised, then you have a gapping of those tight junctions, and then you have increased intestinal permeability. And then that can lead to autoimmunity and significant pathophysiology. The conditions associated here are going to be celiac, type 1 diabetes, and juvenile non-alcoholic fatty liver disease. So in these patients, I would monitor intestinal permeability. We also have considerations for multiple sclerosis, rheumatoid arthritis, asthma, and IBD. We do have associations between intestinal permeability and obesity. So in patients that you are considering obesity, metabolic syndrome, prediabetes, I would think about intestinal permeability as well, because it is higher in adults with glucose intolerance. Okay, and there may be some evidence that intestinal permeability precedes the onset of symptoms for Crohn's disease and type 1 diabetes. And stress increases intestinal permeability. So that's another consideration. Let's take a look at a laboratory result of monitoring intestinal permeability. This is a test of serum zonulin. Serum zonulin is an excellent test that correlates with the lactulose mannitol drink test, and I'll put that up here as well so you can see the results are the same. So elevated serum zonulin family protein indicates intestinal permeability. So this is an excellent test to monitor your patient's intestinal permeability. So serum zonulin is a great test. What are you going to do after your patient has intestinal permeability? And that was a patient with type 2 diabetes. I apologize, I didn't say that. So After the patient has been diagnosed with that elevated serum xylin and you want to restore intestinal permeability, you can consider probiotics, you consider fiber, you can consider specific nutraceuticals such as curcumin, quercetin, vitamin C, omega-3 fatty acids, and aloe vera. You can also take a look at that mucosal barrier integrity nutraceuticals such as L-glutamine, beta-carotene, zinc, things of that nature. And it is very important to actually take a look at the patient's microbiome and see where the levels of those bacteria are, especially those bacteria that significantly contribute to mucosal barrier integrity. So that's going to be the Akkermansia muciniphila, the Ruminococcus species. Take a look at those bacteria, and we'll see that on the GI 360. So what is included in a healthy gut? We talked about balance is very important for our patients. We want to make sure that our patients have a healthy gut, and that would potentially confer health benefits to prevent the pathogenesis of chronic disease. So we're thinking about microbiome abundance and diversity. We want to identify the presence of pathogenic bacteria, viruses, and parasites. We want to understand if our patients have yeast. We're going to look at fecal short-chain fatty acids. We're going to look at inflammatory markers such as lysozyme, lactoferrin, calprotectin. We're going to look at the short-chain fatty acids. We know butyrate, acetate, those do play a role with the pathogenesis of chronic disease. And digestion and absorption is very important. Elastase, carbohydrates, things like that. And then there are some keystone bacteria that we are going to talk about today. The first keystone bacteria we will discuss is Faecalibacterium prausnitzii. Faecalibacterium prausnitzii is a very important bacteria within the human colon. It is very anti-inflammatory. With regards to chronic disease, this is associated with major depressive disorder, Parkinson's disease, cancer, and diabetes. So I would take a look at the value of this for your patients. Akkermansia muciniphila, this is the very popular bacteria of the moment, and with good reason. It does play a significant role with regards to mucosal barrier integrity, and it does play a role we're seeing now with regards to weight, glucose metabolism, insulin metabolism. Okay. So it has been decreased in patients who have been diagnosed with obesity and diabetes. Another important bacteria is the Faecalibacterium. This bacteria produces the short-chain fatty acids, acetate, and propionate. Recall, acetate is important with regards to cardiovascular health. Faecalibacterium is also associated with mental status. So it has been increased in those diagnosed with major depressive disorder and in those individuals diagnosed with Alzheimer's. So we see that connection there. This bacterium likes cruciferous vegetables such as broccoli, so if it's lower, that would be the substrate to consider. Now let's take a look at the GI 360 test to understand the foundational component of a patient's microbiome. The first piece of information we have here is the web, and the web is a visual representation of your patient's microbiome via abundance and diversity. It is that white web there superimposed on the normal biotic reference range, which is the green hexagon. So we can see here that that white surface area is reasonable, so abundance looks healthy, but it's not quite making a hexagon, so diversity looks disrupted. The next piece of information we have are going to be the dysbiosis index and the diversity score. The dysbiosis index and the diversity score are derived from 45 different bacterial analytes and computed to create the values. The dysbiosis index goes from 1 to 5. 1 and 2 are healthy, normal biotic guts, and then 3 is moderate, and then 4 and 5 are dysbiotic. So for this patient, we do not see dysbiosis, but then when we take a look at diversity, the inverse is true. We want a healthy, diverse microbiome. We want that score of 4 or 5. This patient has low diversity with the score of 2. So that makes sense because recall that web is not making a hexagon. They are lower in some phylas and then higher in others. So abundance and diversity, which is that component, that foundational component of so many health outcomes, is represented right here in the first page of GI 360. And with regards to those analytes, when you take a look at GI 360, you will see the specific keystone bacteria that we have been discussing. As an example, in this page, we can see the fecal bacterium proteiniceae, we can see the Lactospiraceae, we can see the Lactobacillus species, the very popular Lactobacillus. We can also see that important Ruminococcus species, which does contribute to mucosal barrier integrity. So you have detailed information, and then you also have a summary page. So let's take a look here at some cases. So our first case is an individual who has really suffered with lifelong obesity. And this individual went to the psychiatrist to address the depression. So this psychiatrist had the fortitude to order the GI 360 to understand the link between depression and the gut microbiome. Okay, so case history includes lifelong obesity and depression, and then the recent history of antibiotics for H. pylori, as well as switching to a less processed food diet within the past 3 months and losing 20 pounds. So that's pretty good. So moving away from that standard American diet. Let's take a look here. So for this patient's results, we can see the web is right here, and this is superimposed on the neurobiotic reference range, which is that green hexagon. So the web looks moderate. It's a good amount of surface area, and it's almost making a hexagon. So we can see that with dysbiosis and diversity are scores of 3. So that's moderate. So let's get more detailed information. When we take a look at this, we can see the patient has low fecal bacterium proteiniceae. Lower fecal bacterium proteiniceae is associated with depression. So we can see a gut microbiome foundation there. This is also going to be lower fecal bacterium proteiniceae is also associated with obesity and inflammation. So we can see a gut microbiome foundational component there. And then additionally, we see elevated proteobacteria and elevated Escherichia species. This is associated with excess fats and excess protein. So the patient is making strides in their diet, but there's more to do. So we can see that the patient would be predisposed for inflammation based on the the higher proteobacteria and the lower fecal bacterium proteiniceae. All right. Our second case is a young woman, 26 years of age, who has had a lifelong history of digestive issues causing stress. I'm sure you see these patients in your clinic. People are younger and they're just dealing with lifelong digestive issues. No diagnosis at this point, and then no relief. So this is causing the patient a lot of stress. She had heard about this concept of leaky gut, so she's going to take a look at that. Okay, so let's take a look at her report. Here we see the web is reasonable amount of surface area, so abundance looks good. Sometimes you'll see these webs very teeny tiny pulled in. So this looks reasonable. Diversity is reasonable as well. We see a little bit lower actinobacteria, that top left corner, a little bit lower Verruca microba. I would think for this patient about her consumption of fruits and vegetables, really, that would be this question. So dysbiosis is moderate, diversity is moderate. Let's get some more information here. So with GI 360, we have this excellent piece of information here, key findings. So the first column is functional guilds. So these are bacteria that are associated with specific functions. We have 5 categories here. We have the butyrate producing bacteria, and for this patient, we can see the butyrate producers are outside the reference range. Therefore, we know the patient's going to be at risk for inflammation within the colon. We also see here that the gut barrier protective bacteria are outside the reference range. When those gut barrier bacteria are outside the reference range, that can lead to intestinal permeability. The intestinal health markers are outside the reference range as well, and so the inflammatory bacteria are within range. The last piece of information we have is that balance between that gut barrier protective versus the opportunistic bacteria. If there's too much too much opportunistic bacteria and lower gut barrier protective bacteria, you can have inflammation, you can have intestinal permeability, you can have translocation. So that's a finding as well. So we know for this patient, even though her dysbiosis is not there, her diversity is moderate, we know she's lower in key butyrate producers. the bacteria that creates the mucosal barrier are lower, and then there's some intestinal health markers are off as well. So what we want to do is support the butyrate producers with soluble fiber. We want to support gut barrier protective bacteria with that information we just discussed with the zonulin information and some dietary considerations. Additionally, we see that the patient has a C. difficile toxin, A and B found, and we're finding carbohydrates. The finding of carbohydrates is actually associated with intestinal permeability because they should not be present in the colon. So that's an indication there. We have a lower secretory IgA, which can be associated with stress, and then we have a higher beta glucuronidase, which is another indication for soluble fiber. And actually, we're going to think about estrogen metabolism for this patient. So we might do salivary hormones or a HUMAP, a urinary hormonal metabolite test. So for this patient, we see that the major fecal bacterium Proteiniceae is too low, where there's disruptions in the ruminococcus species, which are associated with mucosal barrier integrity. So this is the detailed information. Okay, but recall, I'm just going to flip back. The findings are on the first page. So we did know that those gut barrier protective bacteria are too low and the butyrate producers are too low. So that's a good place to make an intervention. Here's an example of her PCR portion of the pathogens panel, because we always want to check for these viruses, pathogenic bacteria, and parasites. And then for the stool chemistries for this patient, we do see the positive carbohydrates. So we're going to address mucosal barrier integrity. The lower secretory IgA, so we're thinking about the status of vitamin A, vitamin D, and zinc for this patient, and then the higher beta glucuronidase. So we're thinking about soluble fiber, calcium D-glucarate, and then we're also going to be thinking about estrogen status. And then our last case here is going to be a doctor. So this is a 57-year-old functional medicine doctor, DO, who runs a busy practice and just decided to do this test before testing her patients. So what do we see here? And unfortunately, this is common with doctors, that there is disruption with regards to diversity. You can see right away, this is almost making a hexagon. There's no significant dysbiosis, but remember, lower microbiome diversity is associated with a variety of adverse physiologic outcomes. So we want to address that. Okay. When we take a look at the key findings, we know the butyrate producers are lower, the gut barrier protective bacteria are lower, and then there's that balance between the gut barrier protective versus opportunistic. So we want to support these butyrate producers. We really want to feed them soluble fiber. Remember, these are the substrates. The soluble fiber feeds the bacteria to ferment the butyrate as the byproduct. And we want to support those gut barrier bacteria. Again, we're thinking about that fecal bacterium Proteiniceae, the Akkermansia muciniphila. Now, her inflammatory bacteria are too high. So again, this is going to be a dietary input, how much fat, how much protein, things like that. We see the elastase is very low, and that is common in patients that are just eating on the run and too fast. So we want to support that with pancreatic elastase, but then also eating hygiene, just sit down, chew your food, things like that. The lower butyrate is associated with the low butyrate producers, and we're going to support that via the soluble fiber feeding approach. Same thing with the total short chain fatty acids. So we want to add soluble fiber to the diet. Here we see the patients, again, the fecal bacterium Proteiniceae is too low, so the butyrate producers are lower. The next step would be, in pathogenesis, would be inflammation. So we want to intervene at this point. Again, butyrate is too low for this patient, so we're going to use the fiber feeding approach. Okay. All right. So in summary, we're thinking about gastrointestinal health, and we're thinking about the development of chronic diseases. Foundational components of gastrointestinal health include probiotics and prebiotics. Recall soluble fiber, 8 to 15 grams per day is recommended. We also want to think about fermented foods and polyphenols, and consider plenty of water, mineral-rich foods, and then specifically, we could use olive oil or fish oil as nutraceuticals. At the end of the day, the considerations are that lifestyle contributes to chronic disease. The gut microbiome and chronic health are intricately connected. The gut microbiome abundance and diversity does influence chronic health. So we want to take a look at our patient's microbiome and address the findings accordingly. Remember, at the beginning of the talk, we talked about the burden of chronic disease. And really, it does make sense to consider the gut microbiome in the pathogenesis of chronic disease and as the foundation for health. Hopefully, this could be a preventative approach. Thank you so much. And now we'll have time for questions.